Today I want to introduce you to a young cat called Sammy who nearly lost his life after playing with a small amount of thread. Let me tell you how. Hi, I'm Dr. Alex from ourpetshealth.com, helping you and your pet live a healthier, happier life. And just a word of warning if you are a little bit squeamish, because this video does include some scenes of surgery. So Sammy first came to see us because he'd been vomiting for a few days. Now, initially there wasn't really any sign of a problem on examination and he still seemed pretty bright, so he was sent away with instructions to come and see us again if the problem continued. Well, the problem did continue. And after admitting him to rehydrate him and to give him some medication, he continued to vomit. And that's when we jumped in with some further investigation. Now, we had known with the history that there was the potential that he had got hold of a little bit of thread and may have eaten that little bit of thread. Although it was felt that it's pretty unlikely, because after all, why would a cat eat some thread? Normally we think of these as dog problems where they eat all kinds of rubbish rather than cat problems, but it was definitely something that had been flagged. So some bloods were run, they were all completely normal. There was no concern there, no sign of what could be causing the vomiting, and so the next step was imaging. We took some x-rays and you can see from the x-rays that there's not a huge amount to see. With a bone, with a stone, with something like that, then you would see a clear obstruction and you'd actually be able to see the object really clearly on an x-ray. What the x-ray does show, and it's quite subtle, is that the intestines have started to bunch up and started to kind of concertina together, and that is a classic sign of what we'd call a linear foreign body. And so there was a strong suspicion that actually Sammy had eaten the thread and it was starting to cause some serious problem within his intestines. At this point I jumped back on the phone to Sammy's owner to discuss the findings, to discuss the likelihood of there being a thread, and to get their consent to perform something called an exploratory laparotomy. So that's where we go into the abdomen surgically to have a look to try and find out what's going on and to fix it. Consent was given and we jumped into surgery. Now, when we fully anaesthetised Sammy, we then saw some thread actually wrapped around the base of his tongue. Now, this is something that we're always taught to look for. It's kind of a classic problem that we get in cats that have eaten thread. And actually, I had tried to check Sammy's tongue when he was awake, but you can appreciate it's right at the back of the throat and there's no way that this could possibly be seen in a cat who wasn't anaesthetised. But that gave us our surefire diagnosis, and then we jumped in with the rest of the surgery. And at surgery we found that all the intestines had all started to bunch up, and you can see how this looks quite similar to the x-ray that we took. It was then a case of cutting the string that was wrapped around the tongue and removing the thread from the intestines. Now, because the thread was so long and had stretched actually from his tongue all the way down into his colon, so the far end of his bowel, 4 separate incisions had to be made into his intestine to remove the thread piece by piece. Because one of the real problems with linear foreign bodies is that they effectively start to cheese wire, to cut their way through the guts wherever there's a bend in the intestine, and that causes them to stick in one spot. So often, especially with a long linear foreign body, a long piece of thread or string or yarn or tinsel at Christmas is another common cause, then you have to remove them in several separate incisions. Now, for every single time we cut into the intestine, there is a chance of complications occurring. So we try and minimize it as much as possible, but we can't just pull too hard because that would cause too many problems as well. Now, because Sammy had been vomiting for several days and hadn't really been eating, we also placed a feeding tube directly into his esophagus. So it goes in through his neck and down into just before his stomach, into his esophagus just before his stomach. And that allows us to feed our patients even when they're not feeling like eating themselves, because giving them food is really important for recovery of normal intestinal function and also for recovery and healing of the intestinal incisions and damage that has been made. So thankfully, Sammy made a full and complete recovery. He was hospitalised for about 5 days after his surgery and he was tube fed during that time, but very soon he actually regained his appetite. He never vomited again repeatedly, and he was bright and happy, and he was a real favourite with both me as the vet and also my amazing nursing staff who took great care of him. And then after discharging Sammy from the hospital, we saw him back a week later just to double check everything was going well. He was gaining weight, he was bright, happy, he was eating well, and his owners were delighted. And I'm grateful to Sammy's owners for letting me share his story with you, just to highlight how important it is to keep everything tidy, about how kittens absolutely will eat and chew and play with things that you might not think that they would, and that can cause severe damage and can be really dangerous and absolutely life-threatening. Because make no mistake, without this surgery, Sammy would have died. You can check out my list of the common household dangers and poisons that could pose a risk to your cat in my video linked on screen now. But until next time, I'm Dr. Alex. This is Our Pet's Health, because they're family.